For all non-EU foreigners present on the Italian territory, it is important to know how the national health system works. In this way, they will be able to make the best use of the services available for the protection of their health and the well-being of the community. What types of health documents are there? And what services do they give access to? First of all, it is important to know that the type of health document available depends on whether or not you have a residence permit. In the absence of a residence permit, as it happens upon arrival in the country, you will be entitled to the issue of the STP code, Temporarily Present Foreigner, by the health facility you are contacting for treatment. The services guaranteed to those in possession of the STP code are urgent care, which cannot be deferred without endangering the patient's life or health, and essential care, related to disease that over time can cause damage to health or risk to life. An example of urgent care is the treatment of trauma due to accidents. Services to prevent worsening or complications of chronic disease such as diabetes are instead considered as essential treatments. The STP code also guarantees social protection of pregnancy and maternity, protection of health of the minor, vaccinations in the context of collective prevention, prophylaxis, diagnosis and treatment of infection disease, prevention, treatment and rehabilitation intervention of drug addictions. Once in possession of the residence permit, it will be possible to apply for registration with the health system to the health authorities, with the issue of the health card. The health card guarantees access to all the services of the health system, on equal terms with Italian citizens. What health services are available? The health system is made up of a network of structures and professionals who provide services based on people's need. There are outpatients and hospital services, specialist medicine, emergency services, and more. Let's see them together. The foreigner in possession of health card will have a general practitioner, or a pediatrician in case of minors, who represents the connection between the patient and the health system. Based on the knowledge of the patient and of his life context, the doctor is able to provide advice on the therapies to be undertaken or exam to undergo, and refer to the services available. He may prescribe, if necessary, drugs, tests, or request for specialist assessment. The patient will then be able to use the services of the health system to carry out the prescribed assessment, after appropriate booking. This can occur in both inpatient and outpatient setting, and in some cases may involve the need for hospitalization. At the hospital level, hospitalization is also possible for interventions that are deemed necessary for patient management. As for mental health, the reference structure is the Department of Mental Health, DSM. This includes both hospital and local structure, such as mental health centers, CSM, or psychosocial centers, CPS. It should also be remembered the possibility of activating, upon recommendation of the general practitioner, home-based health services for those with particular situation. It is important to always keep your doctor informed about the tests and interventions performed. With regard to health emergencies, such as trauma due to accidents, the two reference services are the Community Care Services, SCA, former Medical Guard, and the Emergency Department, PS. The Continuity Care Service consists of a doctor who can be contacted by telephone and who, on the basis of the reported problems, will decide whether to perform a home visit or whether to receive the patients in the dedicated clinic. This service cannot be used by those who are in possession of the STP code only. The emergency department, on the other hand, is a service available at hospital level. It is possible to access the emergency room by direct access or after activating the emergency health service at the number 112, which can deploy an ambulance for the eventual patient's transfer to the emergency department. So, how do you access available health services? And what are the costs? For emergency services, The access methods are both direct access and by telephone activation. For non-urgent services, patients can book services through telephone numbers, websites, or at the counters of the facilities, showing the doctor prescription requesting the exam or specialist evaluation. Regarding costs, emergency services are free for everyone, regardless of the type of health documents you have. This, however, is valid when they are used in a justified manner, and therefore for real urgencies. Otherwise, the patient will be asked to pay for the cost of the service. For the non-urgent services, these will be usually provided free of charge at the facilities of the health system. In some cases, the patients will be asked to participate in the cost, such as for specialist visits and laboratory tests. In these cases, it will be possible to request exemption from payment for particular income condition, in the presence of certain pathologies, in the event of an ascertained state of disability, or for special cases such as pregnancy. To conclude, it is important to remember that everyone has the right to urgent and essential care and other services such as maternity and child protection. Emergency services should be used when strictly necessary to avoid misuse of the service. And you can contact your doctor or pediatrician to be referred to the best service, or you can ask to the health authorities when you are in possession of the STP code only.